Off the field injury evaluation. Evaluation of injuries is an essential skill for allied healthcare workers, specifically on a sports medicine team. This chapter focuses to understand the terminology associated with injury evaluation, incorporate the best evidence in the professional literature to make clinical decisions, and to recognize diagnostic techniques available to the sports medicine team. The terms and knowledge gained from this chapter will impact your understanding of the remaining chapters in this course. For the remaining lectures specifically related to joint specific injuries, we will use correct anatomical terms. Failure to understand the information from this chapter can impact your understanding of the remainder of the course, so this is a very important lecture to understand. The evaluation of injuries. The evaluation of injuries occurring outside of a playing field is an essential element in allied healthcare and is part of a sports medicine team. There are four distinct evaluations that can be completed: the PPE, or the pre participation physical examination that occurs prior to participation, on the field assessment that occurs at the scene of an emergency or at the location where the injury took place. An off the field assessment is performed in a clinical setting, typically in an athletic training facility, physical therapy facility, or even in a medical facility itself. And a progression evaluation. This is a follow up once the treatment plan has begun. To successfully conduct an examination, there are some basic knowledge requirements, such as anatomy and biomechanics, as well as hazards associated with particular activities. If you desire to become an allied healthcare professional, you need to know the demands of your patient population. The knowledge of surface anatomy and body planes and directions is essential. Understanding topographical anatomy is essential. The key surface landmarks provide an examiner with indications of normal and injured body structures. Body planes and anatomical directions are used as points of reference. A foundational knowledge of biomechanics is essential to an injury evaluation. Biomechanics is the application of force which may stem from within or outside of the body. There are four corresponding regions of the abdomen divided for evaluation and diagnostic purposes. There is a second division system that involves the abdomen being divided into 9 quadrants. We will maintain and use the 4 abdominopelvic quadrant system. In the upper right quadrant is the liver, right lobe, gallbladder, part of the pancreas, part of the stomach, the ascending colon, the transverse colon, and the right kidney and upper ureter. The right lower quadrant houses the appendix, ascending colon, lower ureter, urinary bladder, right ovary, and part of the uterus in our female patients. The right testicle is located in this quadrant for our male patients. In the upper right quadrant, we find the left lobe of the liver, part of the pancreas, part of the stomach, the spleen, transverse colon, descending colon, left kidney, and the upper ureter. In the left lower quadrant, we have the descending colon, upper rectum, lower ureter, urinary bladder. In our female patients, we have the left ovary and uterus, and in our male patients, we have the left testicle. Some descriptive assessment terms. You should learn and remember the following terms for the longevity of your career as an allied healthcare worker. Etiology or etiology is the cause of an injury or disease. Mechanism is the mechanical description of cause. Pathology is the structural and functional changes associated with the injury process. Symptoms are perceptible changes in the body or function that indicate injury or illness. This is subjective in nature. This occurs from the patient's account. Some examples are dizziness or a headache. It is not something we can necessarily see, feel, touch, or even smell as an examiner. A sign, on the other hand, is objective. It is definitive, an obvious indicator of specific conditions. This is something we can see, feel, touch, or even smell. Swelling or warmth are examples of signs. A degree is the grading for an injury or a condition, and the diagnosis denotes the name of a specific condition. A differential diagnosis is a systematic method of diagnosing a disorder. This refers to a list of possible causes, prioritizing the possibilities. A prognosis is a prediction of the course of a condition. A sequela is a condition following and resulting from a disease or injury. For example, pneumonia can commonly result from having the flu. And a syndrome is a group of symptoms or signs that together indicate a particular injury or disease process. Off the field evaluation. An off the field evaluation or clinical evaluation is a detailed evaluation on a sideline or in a clinical setting. It may be the evaluation of an acute injury immediately after or several days after the initial incident. The injury evaluation is divided into four components: the history, observation, palpation, and special tests. The acronym for this system is HOPS, HOPS. The history is designed to obtain subjective information relative to how an injury occurred, the extent of the injury, and the mechanism of the injury. We inquire about previous injuries or illnesses that may be involved, as well as past treatments. Some questions you are encouraged to ask during a history may include: what is the problem? How and when did this injury occur? Did you hear or feel anything during the injury process? Which direction did the joint move? And can you describe your pain? Observation should note if any asymmetries, postural malalignments, or deformities are present. Look for how the patient moves. Is there a limp? As a clinician, your injury assessment should begin as soon as the patient approaches you, or as soon as you approach the patient, without them knowing that you are observing them. Once a patient is aware that they are being observed, they will subconsciously alter the biomechanics and may compensate their movements. Palpations. Be sure to gain consent from a patient before you touch or palpate them. In some cultures, this is considered inappropriate, so we want to make sure that our patients maintain their comfort with us as a clinician. Palpate bony and soft tissues, and remember to start away from the site of pain and move then towards the site of pain. Special tests are used to detect specific pathologies or injuries and compare inner and contractile tissues and their integrity. The assessment of special tests should be compared bilaterally. Special tests can be utilized to rule in or rule out differential diagnoses and eventually come to an injury conclusion. Range of motion. Range of motion assessment includes active and passive range of motion. Active motion is when the patient initiates and maintains that independent motion. Passive range of motion is when the examiner or an outside force aids in the motion beyond the patient's independent achievable motion. Neurological and circulation assessments. Sometimes injuries will require you to assess neurological and circulatory functions. There are 12 cranial nerves that may be impaired following a concussion. Sensory and motor function is sensation and action function. Dermatomes are an area of skin that are innervated by a single nerve. To assess dermatomes, you can have the patient turn their head and ask if they can feel a sensation in a specific area. Myotomes are a muscle or group of muscles that are innervated by a specific motor nerve. During myotome assessment, we typically ask an individual to perform specific movements. Reflex testing tests the involuntary response to a stimuli. During a typical annual physical, it is likely that you have probably had your reflexes checked. Most commonly, we assess the patella tendon to see if our patient kicks out when we tap the patella tendon. Clinical evaluation and diagnosis. The use of clinical or scientific methods establishes causes and nature of a patient's illness or injury and subsequent functional impairments due to pathologies. This forms the basis of patient care. A physician is the only one able to make a medical diagnosis. However, other allied healthcare professionals can use evaluation skills to make a clinical diagnosis. Clinical diagnoses involve the pathology and limitations or disabilities that are associated with a specific pathology. Documentation. Complete and accurate documentation is critical for all healthcare workers. Clear, concise, and accurate records are necessary for third party billing. While the process is cumbersome and often time consuming, you must be proficient and able to generate accurate records based on your evaluation that you perform. One example to be able to do this is providing what is called a SOAP note. A SOAP note is a systematic process for record keeping. SOAP stands for subjective, objective, assessment, and plan. Subjective is the statement made by the patients. Primarily, you will include history information and the patient's perception of the severity, pain, and mechanism of injury. Objective should be included with the findings you have during your palpation, observation, and your full physical examination. A is for the assessment. This is our clinical diagnosis. This is your professional opinion regarding the impression of the injury. This may include suspected site of injury and other structures involved along with a rating of severity. You will outline your clinical diagnoses and even maybe your differential diagnoses. The plan includes an immediate and first aid treatment, referral information, goals, both short and long term, and the examiner's plan for the patient's treatment.